It's 1 o'clock. We'll go ahead and call the meeting to order. We get a roll call, please.
Oscar Delgado,
Here.
Robert Lucy,
Here.
Michael Brown,
Here.
Christopher Dare,
Here.
Dr. Danko,
Here.
Dr. Novak,
Here.
Tom Young.
Here.
Chair, we have a quorum.
Great, looks like we got a quorum. Vice Chair Lucy, can you please lead us in the pledge?
My honor. Thank you, Chair. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Vice Chair. Do we have any public comment?
We do not have any public comment registered.
Thank you. We'll close public comment. Item 4, approval of the agenda. Are there any changes, Mr. Dick, officer on the agenda?
No, there were not, Chair Delgado.
Thank you. Can I get a motion to approve?
No motion.
Second.
Second, Rika. Thank you.
Got a motion from Dr. Novak, a second from Dr. Danko. All in favor, say aye.
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 Motion carries. And forgive me, because I know there's a slight delay on Zoom for those that are on Zoom. Item 5, recognitions. Well, District Officer, I saw you.
Thank you, Chair Delgado. I'd like to begin with years of service to recognize Matthew Christensen, Environmental Health Specialist in EHS for 5 years of service. Also, Michael Tui, Environmental Health Specialist in EHS with 5 years of service. So congratulations and thanks to both of them. And then a couple of individuals deserving of extra recognition for 25 years of service, and that's Isabel Chaidez, Community Health Aide in CCHS, and Helen Loreno Solario, also with CCHS and Office Assistants too. So those ladies both started with us back in February of 1996. So thanks very much to them, and congratulations for their service over so many years.
That's amazing. Amazing, 25 years. Wow. Thank you. Thank you to all those that have been recognized for the years of service.
And also, I'd like to recognize Dr. Nancy Doe as a new hire. She's the Division Director for Epidemiology and Public Health Preparedness. And Dr. Doe is a doctorate in epidemiology from Harvard University. She worked as a senior researcher for the Harvard Global Health Institute and Massachusetts General Hospital for several years, and most recently is coming to us from the Rhode Island Department of Health. So congratulations to Dr. Doe, and we're very pleased to have her joining the Health District.
Welcome, Dr. Doe. We look forward to all your hard work here in Washoe County. That's great.
And we do have a resignation. I wanted to acknowledge Vicki Olson, who was serving as our Emergency Medical Services Coordinator. Left us at the end of January to follow her calling as a nurse during the pandemic. And promotion, I wanted to recognize Kara Roseborough, who was promoted from an office support specialist to a clinic office supervisor in CCHS. Began in that role at the beginning of the month, so congratulations to Kara on that promotion. Also like to recognize Virginia McDonald for her 10th Shining Star. The Shining Star Award is to recognize excellent customer service from county employees, and so wanted to recognize Virginia for getting her 10th award there. And as the department, the Health District is sitting at 752 Shining Star recognitions since the program started in 2017. And then lastly, I wanted to recognize several of our community emergency response team volunteers, the CERT volunteers through the Washoe County Sheriff's Office, who have worked with us day in and day out, sun, snow, wind, and rain at our post-testing operation and our pod vaccine dispensing operations at the Reno Livestock Event Center. So we have 6 individuals that have each served more than 500 hours of volunteer service, and some of them much more than that. So I want to recognize Francine Donchik and Terry Donchik, who Francine has contributed 777 and a half hours, and Mr. Donchik 1,177 and a half hours to our operations. Arthur O'Connor, who's also contributed 529 and a half volunteer hours. Ms. Sandra Peterson, who's contributed 820 and a quarter hours. And George Smith, who's contributed 832.75 hours. And then lastly, I wanted to recognize Henry Westcott, who served just approximately 931 total hours. And you may have seen Mr. Westcott on the news being vaccinated when we first kind of did our PR on the opening of the pod at the Reno Livestock Event Center. And Mr. Westcott's a remarkable individual who celebrated his 89th birthday volunteering out there at the pod. So with that, I'd turn it back over to you, Chair Delgado.
Thank you, District Health Officer. Please give our thanks and our many, many thanks and praises to all those that are working so hard, especially our volunteers.
And if I could add for those individuals that I just noted, we'll have a certificate for them from the Board of Health and a challenge coin provided to them, recognizing their service as well.
That is great. Thank you. Thank you. The least we can do. Appreciate that so much. So we'll close item number 5 in recognitions. Is there any public comment on these items?
No, Chair.
Thank you. Moving on to item number 6, presentation from KTMB. Christy, are you with us?
Hi, this is Wes Rubio for the record from EHS, and I just wanted to introduce Christy and say how thankful we are that we've been able to work with KTMB over the past few years. As Christy will probably explain, this will be her last presentation in this role going forward, and she's done a fantastic job for us going forward. So Christy, the floor is yours.
Thank you, Wes. Appreciate the intro.
Yes, thank you so much. This is my last presentation as ED of KTMB, so I am thrilled to be here with all of you. I'm also excited to introduce you to the person who's taking over for me. His name is Mark Cameron, and I just shared my screen, so you probably can't see him among all the little Hollywood square boxes, but he is here with us today, and I've had a chance to work with him for the last couple of weeks. He's going to do a great job. He's ready to go. So this presentation, I just wanted to highlight to you the great partnership that we have had with the Washoe County Health District. As you know, we are a 501c3 nonprofit, Keep Trucking Meadows Beautiful, and we receive funding from the Washoe County Health District to help fund many of our programs that support those that connect with the Washoe County Health District Solid Waste Management Plan. And honestly, that funding has been really integral in helping us to move some of these issues forward. So I want to highlight a couple of these programs that you've helped fund. This past year, we've implemented the new online recycling guide. We launched this with your support, and it provides 3D comprehensive input on how to recycle nearly 39 different items. And so we've had over 7,000 views on this guide so far. It's found at ktmb.org/recycle, so you can check it out. And we have 92 local businesses listed, and I'm sorry, I said 39. It's 339 different items that are listed in the guide right now. And each item has each item has a different category that's listed, where you can either put it in the garbage, attribute it to household hazardous waste, compost it, recycle it curbside, or outlets for e-waste recycling, or taking it to the transfer station or landfill. The other program that the health district is helping to fund that we were able to implement this year is the Green Business Guide, which is something that we launched for the metropolitan, Reno-Sparks metropolitan area in November 2020. This program is for businesses that show they want to care about the environment and the health and wellness of their employees and customers. And once a business registers to become a green business program, a KTMB advisor will reach out to the business and work with them in doing a site assessment and offer technical assistance on how to connect those businesses to becoming more sustainable in their work practices. And it's really exciting because it's a cost savings for a lot of these businesses when they're able to reduce some of their electrical output and things like that. And there's no cost to the business to sign up and get certified. And just since we launched it a couple months ago, we've had several businesses who have registered to be certified. We've got 27 in the pipeline right now, and 3 businesses have achieved the highest status, which is the innovative status, and that's Mercology, Davidson's Organics in Sparks, and Nevada Roots in Reno. So we're really excited to see this going on its way and being so successful in its rollout. As many of you are probably familiar with, we do a lot of cleanups at KTMB, and those cleanups have helped in this past year remove over 200,000 pounds of trash and litter. Even with the pandemic, we were able to implement safety guidelines to make sure that our volunteers were safe going out and volunteering. And although the amount of volunteer hours for 2019 it's nearly 5,000 hours. We still managed to get nearly 3,000 volunteers out during the 2020 pandemic, which resulted in an in-kind value of over $180,000. So there were still lots of impacts that we made, and we were also able to put together maps that show where the cleanups are, and that's something that we've been reviewing with Washoe County Health District staff every month. Other programs that are supported in partnership with the Health District include our annual litter survey, and our Waste Warrior education series. We've been able to continue that in spite of the pandemic. We've been pivoting like other nonprofits to make sure that we are able to continue getting that waste reduction and recycling information out there. We've also been continuing to coordinate the illegal dumping task force and coordinate sustainability partners in Northern Nevada. I have to tell you that as far as looking at trying to solve systemic issues in our community, we have been working behind the scenes this past year to look at what we're doing as a community to address some of these issues. And honestly, we could just be doing so much more, but it looks like really what it's going to take is getting some policies put in place. Right now, we have a goal as a state that was passed in 1991 to get our recycling rate to 25%. There is no teeth in that goal, and so we're currently hovering around 23%. And the EPA just recently set a recycling goal to achieve 50% across the nation by 2030. So something different needs to be done in order for us to improve our processes and get people out there recycling more. We actually also completed this past year a survey of multifamily complexes to find out what their barriers were with recycling. And that's all information that we were able to share with Washoe County Health District staff, something that can be looked at hopefully and addressed more as the pandemic gets a little less severe. So in summary, I promised them I would be really fast. I just want to highlight that we are doing a lot of good things with the funding that we get from the Health District. We very much appreciate the support we get from the Health District. And I just can't say enough good things about the professional and hardworking staff that we've been working with at the Health District. From the top down, Kevin Dick, Jim English, and Wes Rubio. We really appreciate their partnership and support as we have worked our way through the pandemic and trying to hit all of our goals. So thank you for your support.
Thank you, Christy, for the report. Looking to the board if there's any questions. Any questions?
Oscar, this is Christopher.
Yes.
Yeah. I just real quick want to tell Christy thank you. She's been so awesome. She actually has introduced me as when I got in office, I didn't realize all the things they've done. And she helped kind of school me and teach me all the things they do. And I'm a very fast fan. And Mark, you have really big shoes to fill, so good luck. But I can tell you she's awesome. And whatever you're going to, I hope it's fulfilling, and we'll miss you for sure. But we will keep up the good work, and our river is it's so important to our valley. So thank you for all of that work. Appreciate it.
Thank you.
Chair, we also have Jim English making remarks.
Yes, Mr. English.
Good afternoon, Chair Delgado and members of the board. For the record, my name is James English, and I previously managed the waste management program for the Washington County Health District. I've spent 19 years in this program at the Health District, and during this time worked extremely
Doing well. So is he ready now?
And with our outgoing director, Christy, who spent 18 years with this program. So our agencies partnered extremely well in many projects and educational campaigns. And I'd like to take this opportunity to thank Christy for all the collaboration she's done with the Washington County Health District to promote waste reduction activities, recycling education, and awareness of illegal dumping in our community. The ability to work with this nonprofit has been a success for our region, especially the Health District, to help coordinate community-based projects and then promote and conduct cleanups and recycling and waste reduction. The collaboration with Christy that she built between KTMB and Washington County Health District has been a true success for our region, and I have appreciated working closely with her over the years. Wish her well in the future endeavors, and I'm sure the incoming executive director, Mark Cameron, and Mr. Wes Rubio will continue to build on what Christy has started. So thanks a lot, Christy. Wish you well.
Thank you, Mr.
Thank you,
English,
Jim.
for those comments. Very well said. Very well said. Yes, Health District Officer.
Thanks. I just wanted to follow up on Mr. English's comments, and I've had the pleasure of working with Christy for many years prior to even coming to the Health District. And she's been a powerful force for the environment and for keeping Truckee Meadows beautiful throughout her career. And I thank you, Christy. I just wanted to wish you well in the next phase of your life.
Thank you.
Any other board members? Well,
It's Tom Young. I would,
Young.
oh, I'm sorry. I just wanted to mention one of the things I think a secondary real benefit of Keep Truckee Meadows Beautiful has been that, and Christy, how many volunteers actually pitched in the last year or two?
Generally, we work with more than 5,000 volunteers. That number has dropped a little bit with the pandemic, but we were up to over 5,000 volunteers in a year.
Right, and I think that one of the benefit of having so many volunteers help out is that it gets a lot of our citizens engaged in a positive direction, and that translates into a whole lot more benefits, and that's really a tribute to you and what's happened at Keep Truckee Meadows Beautiful. Thank you.
Thank you for those words, Mr. Young. Any other comments? Chris?
Chair Delgado, I do have one question when you got a second.
Please.
When she talked about our recycling and stuff, I'd love to learn more of how to get to where we got to go. I know I've had some conversations last year with a few, and it does seem like we're kind of just stuck in whatever pattern we're in right now. Part of it probably is no teeth, like she said, possibly. I don't know. But I don't know how we get out in front of this a little bit more. So I just want to put that out there on the record and let her know as she goes that is, I appreciate she said that, but I'd like to hope that we can make some strides.
I think recycling is important to all of us, and we'll figure out how we can continue to push that forward. And again, that's through a lot of your leadership too, Chrissy. So thank you so much from me to you. Appreciate all the hard work you've done in all of our communities, especially finding ways on how you can engage people that live in communities that have felt as though they've been displaced in many different ways, are not part of the conversations. You've been able to engage with them and make them feel proud about their communities and their neighborhoods, and that's always going to sit so high on my bar. So thank you for all that hard work. Mark, I know you have big shoes to fill, but Christy's left a tremendous foundation for you to build on. So thank you so much for your commitment to our community. Good luck on what you're going to accomplish next. I know they're going to be great things. And again, thank you, thank you, thank you. So with that being said, well, is there any public comment with item 6?
No, Chair.
Thank you. We'll close item 6. Thank you for the report. Do we need to accept the report? No? All right, we'll move on to item 7, Inter-Hospital Coordinating Council presentation of accomplishments. Do we have Tammy Oliver on?
Tammy Oliver for the Ihcc for the record. You here? Introduce.
And hi, this is Jessie Latchoff for the record, the Public Health Emergency Response Coordinator for the Ihcc. And we're here to present the accomplishments for the Ihcc. Is everybody able to see our screen?
Yes, we are. Thank you.
Okay. And I'll hand this over to Tammy.
Thank you. So today we would like to review what we've accomplished from the Ihcc over the past year. When we talk about what we do within the community, it's not just one partnership, it's all of our community partners working together so we can build resilience in our community and improve our response. When we're reviewing our accomplishments this year, it was quite the long list once we started going through everything and reviewed it with our team. But our accomplishments included the Ebola drill, coalition, surge test, and CMS exercise, partner sharing of resources, mass casualty incident and alpha plan updates, coalition members resource gap analysis provider plan updates, points of dispensing, that's our pod plans, our memorandum of understandings, and then our post collaborations. In addition to that, we reviewed our crisis standards of care and got it to where it needed to be. And we also completed the triannual airport exercise. One of the first things that we did prior to everything going out was help out with the junior RTOC and then the Washoe County School District with the Stop the Bleeds kits and provide donations for that team to put those out within their schools. Great bunch of kids. We are proud to be part of that. This picture that was presented is prior before the pandemic. We completed our Ebola exercise, which was a full-scale exercise that was completed at Renown Health that included Remsa, Renown, and UNR. And this was in February before the pandemic, and we did a real-life scenario with the Doctors Without Borders. And in addition to making sure that we completed a very aggressive after-action report with this one, we also did some filming so that when our new staff comes in or within the community with Remsa and our partners, we'll be able to show these clips of our videos of what our community can do and how we can safely take care of these patients. Right in March, we completed our coalition surge test and our CMS exercises. This is required for the guidelines based on our AFSPR and has to be done within 90 minutes. This happened to be at Renown Health. This was actually the same day we set up incident command. The team actually did a fabulous job. And then we also completed the emergent evacuation exercise up at the REOC right prior to the pandemic starting as well. On March 5th, we received our first patient into Washoe County, which started us down our journey to changing the way that we do business and going over to more of the current controls that we see in place today. We were able to deploy our deployable field hospitals or deployable hospitals from the state. We had those both at the St. Mary's campus and also at the Renown campus. And then we also have one down at the South Meadows campus as well. These medical tents were used for respiratory for additional surge capacity, so we didn't have long wait times within the hospital and we can safely move people through. We also were able to utilize the Strategic National Stockpile Distribution with the CDC. So within our plans between the coalition and then the state plans, we utilized the resource request, and we were able to move the appropriate PPEs to support the pandemic throughout the community on an ongoing basis. We completed quite a bit of, this is one example of our partner sharing and collaboration. So during this entire event, we collaborated with our members of our team. We all helped each other. But this one specifically an example where Lakeside needed PPE, and we were able to provide them with PPE through Remsa to keep that collaboration going. And then the Washoe County Health District had strike teams that they deployed out to the skilled facilities areas to do testing. And then in addition to that, we were able to provide Abbott ID Now instruments and kits throughout our community partners to continually test and keep moving through the pandemic. Reno, Nevada was recognized for having one of the largest negative pressure field hospitals in the United States. So we were able to build out, in addition to our alternate care site program that we have within the community, we were able to build out in addition to the tents, the field hospital to support the surge capacity of the patients coming into the community. And now we've rolled over to the COVID-19 vaccine coordination. So in December, we were able to utilize our points of dispensing plan, and we were to start the vaccine rollout for the COVID-19. We work closely with all of our community partners to get all of our Tier 1 staff done, and then we've moved on through the community tiers as appropriate with Washoe County Health District. And we continue with that movement to vaccinate our entire community to provide a safe and healthy environment. And that is the end of our presentation. What we say now is alone we can do so little, together we can do so much. So without our team members and without the collaboration within our community, I don't think that we as a community would have the resilience that we see during this pandemic as we hit our year anniversary. Thank you.
Thank you. That's amazing. Gosh, you guys do so much work. Any comments from the board?
I do have one. Over the last couple of years on the board, I have attended most of these meetings. It is an incredible group of people. Tammy, how many members are on the Inter-Coordinating Council now?
I think there's close to 250 members now within our community in all different aspects that touch the healthcare system.
It is such an absolutely diverse number of partners, anywhere from water supplies, janitorial things. It is just, and it is run so professionally from the word go, along with true federal standards and everything else. So I can't say enough about this program and being part of it with our health district. So way to go, guys.
Absolutely, way to go. Is there other comments from the board? No, just thank you to all those involved. I appreciate so much, Tammy, and to your board and to all the volunteers. You never know when you need all these trainings until it's upon us, right? And it doesn't show more real than now. So thank you for continuing to keep us all on the same page and working together. It's amazing work that you guys are doing. With that being said, any public comment on this item?
No, Chair.
No, we'll close item number 7. We'll move on to item number 8, consent items. District Health Officer, are there any items that need to be highlighted?
I think the consent agenda is fairly standard with the approval of contracts. I do want to recognize the Burning Man project for a cash donation that they are making again this year to support purchase of birth control methods and to help decrease unintended pregnancy rates. So a generous contribution from them. And then also the a zero value contribution of points of dispensing cages that were provided to us without charge that we are proposing to provide over to the school district for their pod operations.
Thank you for those highlights. Any board members want to pull any items from the consent agenda?
This is Brown. I'll make a motion to approve.
Got a motion and a second. Can I get a second? I have a second. I'm sorry, any public comment on the consent?
No, Chair.
Seeing none, all those in favor say aye.
Aye.
All opposed, motion carries. Motion carries. Thank you. Moving on to item 9, Regional Emergency Medical Service, Remsa. Do we have Dean Dow on?
Good afternoon, Mr. Chairman and members of the board. It's actually Adam Hines, Executive Director for Remsa. Mr. Dow's not here today.
Good to see you.
Good to see you too, sir. You have received all a copy of our January compliance report. I know here shortly you'll be hearing from our board chairman, Mr. Tim Nelson, as well as Executive Director Abbott about discussing some of our exemptions. But for this specific report, I'm available to answer any questions that the board may have.
Any public comment on this item? No? Any comment from the board related to item A? See none, it's an action item. Can I get a motion, please?
No.
I have a motion and a second. All those in favor say aye.
Aye.
All opposed, motion carries. Thank you. Item B, Alexia, you're up.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for Remsa, for the record. Of course, you have for your review the Public Relations Report for January. I also have a couple of more recent updates to share. In late January, Remsa paramedics Scott Zettelmeyer and Zach Lucas, along with paramedic student Blake Miller and Truckee Meadows Fire Protection District firefighter paramedic Bo Retzer, delivered a baby girl in the back of a Remsa ambulance on the side of the road and in a snowstorm nonetheless. A happy, healthy mom and baby were then transported to Renown for postpartum care, and this great story received some local media coverage. Last week, Remsa's Center for Pre-Hospital Education graduated 13 new paramedics who began their journey in January 2020 and completed the education course throughout the pandemic. The graduation event received media coverage on Colo and on KTVN. Once the medics complete their written and psychomotor exams, these students will be eligible to work as nationally registered paramedics. Remsa's paramedic program includes didactic and lecture time, clinical site experience in areas like the emergency department, operating room, labor and delivery, and 480 hours on an ambulance as a functioning entry-level paramedic. So this is a quite an undertaking for these folks. Congratulations to the January 2020 cohort of paramedics. Also, as February is Heart Month, we worked with Andy Guevara at KTVN to feature Remsa's Public Education Coordinator, Alma Marin, who has dedicated many years to expanding CPR education in our region. I encourage you to tune into KTVN today for the Someone to Know segment to learn more about Alma and her incredible work in our community. And finally, one of Remsa's search and rescue paramedics assisted with the Washoe County Sheriff's Office in the rescue of the Davis, California couple that was stranded in northern Nevada last week. Paramedic Scott Zettelmeyer was included in some television media coverage in Sacramento related to this situation. As a reminder, be sure to follow Remsa on our social media channels, Facebook, LinkedIn, and Twitter. And I'm available to answer any questions you may have about our public relations report.
Thank you, Ms. Jobson. Any questions for Ms. Jobson related to the report?
How's the baby doing?
Great. Mom and baby are healthy and well.
They did
That's
name the
amazing.
baby after you, Christopher.
Dang it. You caught me.
Great presentation. Appreciate it. Thank you, Ms. Jobson. Don't need any action item on that one. We'll move on to item C9c Financial Audit. Mr. Nelson.
Good afternoon, Chairman Delgado and members of the board. For the record, my name is Tim Nelson, Remsa board member and member of the Finance Committee. I'm here today with our CFO, Barry Duplantis. Though it may be hard for some of you to believe who were around at that time, I was appointed just over 7 years ago in January 2015 as a CPA representative to Remsa by this board. and I'm here to report back to you on this year's annual financial audit for Remsa. Our annual audit was completed in December of 2020 and presented to Mr. Kevin Dick as part of our annual franchise compliance. We once again received the highest opinion available from our auditors. I'm happy to report that over last year, we achieved a positive net change in our net assets of $2.8 million approximately on a GAAP basis. Within that figure was approximately $2.5 million of depreciation, so we had a little over $5.3 million available for capital and debt service needs from our recurring operations. In addition to that, we received $5.3 million in payroll protection or PPP loans, which we used to assist with payroll coverage during the worst of the COVID pandemic. And these were appropriately recorded as a liability on our financial statements at last June 30th in accordance with GAAP. We have since requested forgiveness as permitted by those loan provisions under the CARES Act and under consideration by the SBA currently. On top of that, Remsa received $919,000 from the U.S. Department of Health and Human Services in April and May of 2020, all of which was used to pay for COVID-related expenses like PPE. In fiscal 2020, we also improved our balance sheet through the sale of unused building and property, and we continued to reduce our debts by $3.4 million, which is always a good news item, inclusive of the mortgage on the property sold. In 2020 and early 2021 now, the Remsa board approved $1.9 million for the purchase of replacement and refurbishment of ambulances, as well as to pay for the purchases of all the related equipment, such as gurneys and radios and monitors that go along with that. And I am pleased even more to report that all such purchases were paid via cash and no new debt has been added. Since the June 30th financial statement for the 6-month period ended December 31st, we have performed very close to Remsa's budget for the fiscal year and is showing a positive change in our net assets of just over $400,000. As a board and as a Remsa organization, we're continuing to look for opportunities to improve our efficiencies and expanding our patient care in our region. And at this time, I'd be happy to answer any questions you have regarding the finances or other questions about our Remsa.
Thank you, Mr. Nelson. Any questions related to the audit from the board? See no comments. Thank you for the clean audit. Always great to, yes, Mr. Dare, is that you?
I was going to say, I moved. Do we need to accept that? I was going to move to approve for you.
No action is needed on this. It's just a presentation. But
okay, thank you.
Thank you for jumping on that. Thank you, Mr. Nelson. No questions. Appreciate the clean audit. Thank you for the transparency and providing the.
Thank you all. Absolutely.
Thank you. Moving on to item number 10, discussion, potential approval. This was continued from the last meeting. Mr. District Health Officer, can you please give us a briefing as to where we are now?
Yes, so this is the item that was continued from the last meeting. We just adjusted the time period that would be to make this retroactive from July 2020, which it was as an item last month, but lasting now 60 days from the date of approval by the board rather than the 90 days that we had last month, so that it doesn't continue forever, but the board does have the opportunity to revisit this at a future date if they wanted to extend that. And I believe we have Julie Hunter available to present or discuss the item further.
Yes, Ms. Hunter, please.
Thank you. Good afternoon, Mr. Chairman and members of the board. For the record, Julie Hunter, Emergency Medical Services Coordinator. As Kevin just described, this item was discussed at last month's meeting, back on the agenda for possible action. The only change, as Kevin mentioned, was the change from the 90 days to the 60 days from the date of approval. I would like to turn it over now to Aaron Abbott so he can give you a brief overview of the reasoning behind the blanket exemption. Thank you. Aaron?
Thank you, Julie. Thank you, Mr. Chair, members of the board. For the record, Aaron Abbott, Executive Director for Remsa. As you all know, this has been a challenging year dating back to March. There was a state and federal declaration of emergency. Beginning in about July, which is why this exemption request is extended back to July, we started seeing significant impacts to our emergency medical services system. We've made a multitude of adjustments to try to mitigate those impacts. In fact, over 60 different programs were enabled here internally to help mitigate those impacts. But nonetheless, we did have significant impacts starting in July. Since March, we've lost over 24,000 personnel hours due to exposures, symptomatic employees, as well as COVID positive employees. We saw significant offload delays at the hospitals and a widening geographical response area as folks began to stay home more and more. They weren't coming into the core of the urban areas to do business or to go to school or to socialize. And so that caused a widening and a spreading of our geographical response area beyond what it normally would be. All of those details are in our COVID-19 impact report. At the request of Councilman Dare, we did include into this agenda an update to include January's figures in the report and to update you all on where we currently sit. We are seeing, starting to see a softening in the COVID-19 impacts. They're really associated, if you remember what our impacts were like back in September or early October, that's around about where we're sitting right now from an EMS system impact perspective. So things do seem to be coming back down the other side of the hill. We do hope that it remains that way. And I'm here to answer any of your questions that you may have regarding this exemption request.
Thank you, Mr. Abbott. Looking to the board for questions for Mr. Abbott or Ms. Hunter.
I do have one question, Chair.
Yes, go ahead, Mr. Dare.
Yes, thank you for putting that in there. I did want to know, it seems with everything going down and I'm getting hospital reports, it seems that they are definitely opening up. Does that still seem to be a problem at this point for you guys? Or am I right that issue is starting to cease as well, of having to sit and wait because of hospital use?
Yeah, the hospital offload hours, number of times that we're being delayed at the hospital and the amount of time per incident we're being delayed at the hospitals is softening with the rest of the numbers. So again, we are for January above September's offload delay issues, but below October's. So we're not quite where we want to be. It's kind of interesting that our threshold has sort of changed. We still had 202 offload delays for January, and normally we see that number in the tens. For example, under normal system conditions. So normally. Under normal circumstances, compared to normal circumstances, we're much higher, as well as offload delay times. We're still looking around the 30-35 minutes above our normal offload delay. And typically when we have an offload delay, it's 15-20 minutes, and they're, again, much fewer in frequency. So it's getting much better. We're really pleased with our hospital partners for working on that for us. They've been engaged in trying to reduce that impact for us, and we are seeing a significant lessening in that area as well.
Thank you. And the one final question, will some of the hiring you just did help with some of this as well, potentially? It sounded like you had 13 new recruits or something of that fashion.
Yeah, so number of paramedic students is different than the number of people that we're hiring or employing. We do continue to recruit very, very heavily. We've had, in fact, in this month's recruitment class, separate from the paramedic program numbers you heard earlier, I believe we have 18 additional employees coming onto staff. Some of them are a mix of field providers, dispatchers, logistics technicians, et cetera. But we do continue to bolster our staffing numbers really as quickly as we can.
Thank you for what you do and the information, and we'll I look forward to continue to walk with you, obviously, and as a region, we do this together. But hopefully, we can get back to our times because they obviously do equal a lot of health for our community. Thank you.
Thank you, sir.
Any other questions?
Yeah,
Yes, sir. Mr. Brown.
Mike Brown here.
Chief Brown.
Hey, Aaron, thank you for all the information and good reporting. As far as monitoring, I know Remsa is doing most of the monitoring themselves. Are we bringing these discussions up on our weekly meetings, the EMS committee and such, that we're all on the same page and what's going? Because I think it would be great to everybody work together to see what we could potentially do to decrease those wait times at the hospital. If there's something public safety can do, or any one of us, to help out.
Yeah, so we actually have had an agreement with Truckee Meadows Fire Protection District to help run a significant portion of ambulance calls in Washoe Valley and in Sun Valley for us on an auto aid basis. They've been great partners through this. They've even, been partners in assisting with communication on when ambulances are being delayed and, making some of their paramedic staff available to help offload issues if and when they arise. We have been working and keeping the EMS oversight folks, Julie and Andrea, apprised of our system needs and what's been going on, and specifically the tiered response structure that we put into place, I believe, beginning August 13th, has been discussed weekly basis with our other response partners, our fire department partners. That program has been, by our account, successful in mitigating a handful of very low acuity calls and reserving advanced life support ambulances for higher acuity calls. And we do report those numbers to that group, and we have an opportunity every week to talk with that group of fire partners as well as the EMS oversight folks on anything that's potentially going on in the system that needs potential assistance with, or just in general sharing of information.
Good deal. And I believe, Julie, you'll probably be helping monitor this as well, correct?
Yes, sir. And then, in fact, we will be having biweekly meetings with the task force that we had created with you, focusing really on the tri-data reports, CPSM reports, and creating common standards of care.
Good deal. Chairman, if you're ready, I'll go ahead and make a motion on this. This is Brown.
Yeah, just looking at any other questions, Vice Chair. Lucy, please.
Thank you, Chairman. Mr. Abbott, I'm being that new to this process in regards to the response times. Obviously, we need to, the requirement per the franchise agreement is the 8 minutes and 59 seconds, and it seems like we're right there at that cusp. Does that start? When does that timer start for my edification? Can you explain that? I mean, does that start at the dispatch, from the call to dispatch, or when does that timer start?
When Remsa receives the call, we get three pieces of information. We get a caller location, we get callback number. We need those two pieces of information, to know where to go. And then if we get disconnected from the caller, we want to know how to call them back immediately. And then we get chief complaint. Chief complaint's important, obviously, because what the reason that the caller is calling is a patient having chest pain, do they have a stub toe, do they have cold or flu-like illness, is important in determining priority. But once we have those three pieces of information, our response time clock starts and then ends when we have wheels stop at the scene.
So it's not necessarily the offload, but the offload situation at the hospitals, as Member Brown pointed out, can take a certain number of units offline for a period of time, which will ultimately impact that timeline. So I think it's a wonderful suggestion from Member Brown that we have that conversation with the EMS board and have that discussion to see how we can make an impact, not only from the delivery of service, but also at the hospitals as well. So
yeah, I appreciate that comment. When we are tied up at the hospital with 4 or 5 ambulances for an extended period of time, it does really inhibit our ability to be pre-positioned in other areas of the community to properly respond to additional 911 calls.
Great. Thank you, Chairman.
Any further comments? Seeing none, do we have any public comment?
No, Chair.
Can I get a motion, please, on item 10?
This is Brown. I'll go ahead and make a motion to approve this with the caveat that if we see a drastic change in what's taking place with our COVID situation through the monitoring of it, all partners, that we revisit this within that period of time and potentially make changes to the request that Mr. Abbott and Remsa are making.
Second.
A motion is second. All those in favor
Second,
say aye.
Rika. Thank you.
All those in favor, aye.
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 Any opposed? Motion carries unanimously. Thank you.
Thank
Item
you.
11, presentation discussion regarding the appeal and waiver process. Mr. District Health Officer.
Thank you, Chair Delgado. We have Francisco Vega, our Air Quality Management Division Director, and Aaron Dixon, our EHS Division Director, available to provide this presentation on that appeals and waiver process for those two divisions.
Thank you.
Thank you, Mr. District Health Officer, Chair and members of the board. For the record, Francisco Vega, Director of the Washoe County Air Quality Management Division. Just want to confirm everybody can hear me?
Yes.
Okay, perfect. So I'll be kicking this presentation off, discussing the processes within air quality. Let me begin by stating that the appeals of air quality actions is governed by section 020.0252 of the Washoe County District Board of Health Regulations governing air quality management. As the second bullet shows, section 020.0252 states that all appeals to the hearing board shall be initiated by the filing of a petition on forms prepared by the control officer within 10 days after the person bringing the appeal has received any order or notice of violation issued by the control officer or his authorized representative, or has had any permit as required by these regulations issued, denied, renewed, suspended, or revoked. Before any action can ever be appealed, there's a tremendous amount of work that is conducted by air quality staff in working with the regulated community. The compliance and enforcement process begins with either an inspection or as part of an investigation into a complaint. At the conclusion of the inspection or investigation, a report is created, and if non-compliance is discovered, the evidence is reviewed by management and or senior staff to determine if there is enough evidence to support the issuance of a notice of violation. It should be noted that during the inspection and or investigation process, if non-compliance is discovered, the focus of the air quality inspector is to work with the company or individual to get back into compliance as quickly as possible, and any potential enforcement action is passed on to management and or senior staff. After a review of the evidence by air quality management and or senior staff, there are three possible outcomes. Possible outcome number one is the first is the evidence does not support the issuance of a notice of violation. In this case, no further action is taken. The second possible outcome is that evidence supports the issuance of a notice of violation, and the penalty for the violation is set by section 020.040 of the regulations. These are typically minor violations, and in this case, the regulated entity is sent a certified letter which describes the violation, the penalty amount set by regulation, their appeal rights, and a copy of the appeal form. The regulated entity also has the ability to request a compliance meeting during the 10-day appeal timeframe. The last possible outcome is that the evidence supports the issuance of a notice of violation, and the penalty for the violation is not set by regulation. In this situation, the case will proceed to the enforcement panel for review. The enforcement panel, which, as it is described on the slide here, is made up of staff members completely independent from the compliance group. The enforcement panel will review all relevant information and as a group decide to issue a warning, penalty, environmental project, or a combination of these. In the case of the issuance of a warning, a certified letter is sent to the regulated entity and the case is closed. If the enforcement panel decides to move forward with a recommended penalty and or environmental project, a compliance and enforcement meeting is scheduled with the regulated entity. The meeting represents the regulated entity's opportunity to present any information that contests the issuance of the notice of violation. As it described in the slide here, the regulated entity is provided all evidence prior to the meeting for their review. If no information which contests the issuance of the notice of violation is provided, at that point, the recommended enforcement action is presented. If the recommended enforcement action is found to be acceptable and the regulated entity agrees to not appeal, the penalty is reduced by 10% and the case is presented to the District Board of Health as a consent agenda item for approval. If the regulated entity does not find the recommended enforcement action to be acceptable, a certified letter is sent, which includes a final notice of violation, a recommended penalty, appeal rights, and a copy of the appeal form. After 10 days from the receipt of after 10 days from the receipt of the certified letter, the regulated entity has the option to file an appeal with the Air Pollution Control Hearing Board. If an appeal is not filed within the time frame, the case is presented to the District Board of Health as a consent agenda item for approval. If an appeal is filed, the case will be heard by the Air Pollution Control Hearing Board within 60 days. After the Air Pollution Control Hearing Board hears the case, all findings and recommendations are forwarded to the District Board of Health for final decision. All the information I just went over is summarized and available in a flowchart that has been provided in your case. With that, I'd be happy to entertain any kind of questions or discussion.
Looking at the board with relation to questions to the air quality appeals process. I know the appeals process in general is an important conversation we had at the concurrent meeting. I know Mr. Vega and his team and the District Board Health Officer is trying to provide some more information for all of us and all those in the community as to the process. And Mr. Vega, I believe you guys have already done some work in terms of making it user-friendly on the website as well. Is that correct?
That's correct. We have added a web page that describes the process and also makes available the appeal form and information necessary to navigate the process.
Thank you. I look to the board for further questions related to the air quality management appeal process.
I got a couple questions.
Yes, Mr.
Chair.
Chair.
Yes, one is on the enforcement panel. You said staff members. Where do we get those staff members from? You say they're not involved, but are they staff members that are from the same? Are they just volunteers, or where do we get those? So we just understand who's doing what.
Yeah, so they Francisco Vega, for the record, they are air quality staff, but they are staff members from other branches within air quality, primarily from our planning and monitoring group. So again, they're independent from our compliance inspectors, I think is the main point there.
And then when it comes back to appeal, is that going back to them or to another group of people that's within the same group? I know ultimately it comes, you said that it comes back to us as a health board, but I'll get to that in a moment. But does it go back to them for an appeal?
Francisco Vega, for the record, it goes to the Air Pollution Control Hearing Board, which is completely independent from air quality altogether.
Who makes that group up?
I believe there's some appointed by regulation. There's 7 members. Again, I believe some of them are set by regulation, but in order to answer your question completely, I'd have to refer back to the regulations.
It's all good. Part of our question.
Our district health officer can answer that question for you.
Thank you. Appreciate it.
Yes, this is Kevin Dick. So the composition of the Air Pollution Control Hearing Board, some of the members are designated based on type of profession that they have, so that there's some industry representation, there's some engineering representation, and those members are all appointed by the District Board of Health.
Is there?
I'm sorry, go ahead.
So for transparency, District Health Officer, are those names, can people in the general community apply for those positions? And if so, how?
Yes,
How
when
do they become on a list, and are those names available to the general community in terms of who sits
So
on the
those,
committees?
thank you, Chair Delgado. I believe those names are posted on the website for information on the Air Pollution Control Hearing Board. And when there is a vacancy, then we are recruiting from the community for those positions, and that's an opportunity for people to apply for those positions, be considered by the board.
Perfect.
Are do those have term limits, or so you say when there's an opening, have they been the same people for a long time, or is that something that is revolving?
I don't believe that there are term limits associated with those board positions.
I don't remember ever, I've been on this board for 5 years. I don't remember ever being a part of that. Now, it doesn't mean it's not true. We vote on a lot of things, and I'd like to believe I would have remembered, but so, okay, I'm just trying to get, again, this is, the question is just trying to understand the process of how we get to where we're going, who's on what, and making sure that it's representing what we're looking for. But then my other question is I know that we say that it comes to us. I don't remember, I remember probably once seeing something come to us, somebody upset about something, I guess. We just don't get many of them that I remember coming to us. Is that just because they're in the consent and we need to pay better attention to what's in there?
I'm sorry, Mr. Dare, with respect to an appeal?
Yeah. So I mean, the appeals, I don't see them. At the end process, it says that it comes to us as all the appeals come back to us. I just want to know.
There was an appeal that came to us today, Mr. Dare, in the consent item E.
It was that the one for Di Loretto that I saw? Okay, I did see that. Okay, thank you.
Any further questions from the board?
Tom Young here too. I just, how long has this, have we actually, this website, just explain the appeals process been up?
Francisco Vega for the record. The webpage was created recently within the last couple weeks. And that, again, that was something that we added in order to add transparency to the process.
Great. That's very good progress to get that rolling.
It was something we heard loud and clear from the concurrent meeting, make sure we are being user-friendly, making sure we have information available to the public. And from what I hear from you, Mr. Dare, there's opportunities too to better understand how we can get folks or new people, or new set of eyes available for those that want to serve in the capacity of being involved with what we do. So I hear you, and I feel the same sentiment. So opportunities for us to kind of consider down the road.
I do have one more thought too, if you don't mind.
Sure.
So looking at this, like today, Di Loretto, I don't know. It seemed like by the time it gets there, we're just approving what already happened. Nobody's asking us if we're okay with it necessarily. Like, hey, this is the situation. Can you guys be the final voice? It seems like it's more, hey, this is what got done. This is what we did, period. And so that's part of where my confusion, I think, why I think I was confused on these appeals. I think maybe going in the consent is not the right idea, maybe, if they're asking us to actually look at them. Just a thought.
Mr. Chair,
I don't know.
Sure. Vice Chair Lucy.
Thank you, Chairman. I have a tendency to agree. I mean, Mr. Vega did lay out a very detailed process in which the appellant has many opportunities to move through the appeal. I agree with Member Dare. This should not be in a consent item. This should definitely come and have a staff presentation rather than just a presented staff report. You know, I understand in the staff report there's possible motions, but there is also recommendations, and so we would want to know a little bit more about this. Is really a quasi-judicial discussion, and when they're asking for an appeal, and I'm assuming the health district officer, do they pay for the appeal, correct? There's a cost associated.
If I could comment, the items that come under the consent agenda, there are two types. There is one, as we have today, that was not appealed.
Not appealed, sorry.
So that was, they agreed, and they agreed to pay the fine and settle the issue there. And then there are other items that can come to the board, but they are very rare, where they do appeal, and it goes to the Air Pollution Control Hearing Board. And there's no fee for appealing to the Air Pollution Control Hearing Board. And then if that recommendation from the Air Pollution Control Hearing Board comes to the board to make a decision on. And those are identified separately under the consent agenda. But if the board would like, we could pull those items that have gone to the Air Pollution Control Hearing Board and have them be a separate item on the agenda that's not in the consent agenda.
And this is, Chairman, I apologize, and if you'll entertain this for just a minute. I see what you're saying, Health District Officer. I do, and you know, an acceptance of a penalty is fine for me. I agree with that process as it was posted today in today's item. But I would you know, recommend and ask that, you know, if those are going to come forward, that we do have a little bit more of a robust presentation. But for me, this is fine. I just wanted to have a little greater understanding about it.
Can I say one more thing, Chair? Because I don't know if we need to entertain something or ask something to come back a process or just ask that we get it moved. But I would say that if somebody actually has went to the appeal board, then different than today, I don't have a problem with today, because I think on consent, and again, my bad maybe if there's things that have come through, but usually it's like today that it's just done. It's like, and I've even brought things up before, and these guys will remember, and they'd say, well, it's already done. And I'm like, well, no one came to us. So, but it's because it's already processed, it was done. So, but if something's in process still, and we're getting, we're somehow, I never want to be a rubber stamp to something. I'm not saying anything wrong. I'm not saying staff is wrong. I'm not even saying that the people on the air board, you know, air control board are wrong. I just, if it's going to have our name on it and we're going to agree to it, I want to understand it better and make sure that there's some accountability across the board. So I would prefer that does come not in a consent where I have to try to figure out which one it is.
Sure, I could work with the district health officer. I hear what you guys are saying to add to opportunities to have further discussions on some of the appeal process or those that are going through that process. I know it's item E. Currently, we have the opportunity to pull items from the consent to have further discussions. They provide opportunities to, in terms of recommendations, alternatives, so that there are opportunities to hold back and things aren't necessarily done as maybe presented, but we can definitely highlight those opportunities, and I'll work with the district health officer in future agendas as they come forward. Any other questions on the air quality portion? Seeing none, we'll move to the second part of the presentation from the Environmental Health Services.
Good afternoon. This is Erin Dixon with the Environmental Health Services Division. Just want to make sure you can hear me and see my screen.
Yes and yes.
All right, wonderful. Thank you. Thank you so much for this opportunity to, that did not move forward here. Okay, thank you very much for this opportunity. I do want to just give you a reminder of what the Environmental Health Services Division looks like. We are broken up into 3 sections. First one's consumer protection, our food safety and permitted facilities, our environmental protection, vector waste management, land development, and then the recent addition of what we call SB4, which is our resort inspections that were as a result of COVID. Environmental Health Services is governed by multiple NRS and regulations. All are located on our website, including the dates they were approved by the District Board of Health and, if appropriate, the State Board of Health. In front of you, I'm sorry, I'm struggling with the screen here. This is the first half and the second half. Please do not worry. I am not going to go through the appeals process individually for each regulation in detail. I have grouped the likes appeals process for you into 4 general groups. However, before we get into the appeals, I'd like to highlight two processes that are available prior to an inspection or notice of violation. It is a proactive approach, and that is our variance and or waiver process. A variance allows a permit holder to apply for, in advance, a part or parts of the regulations to be adapted to meet their individual needs, as long as there is no impact to public health. There's an application and a fee for the variance and process. The request is reviewed and with the applicant to ensure that both parties are on the same page. It can even be the environmental health specialist staff that recommends the applicant request the variance if they identify the need. The process is as listed, depending on which regulation it is, whether or not it is reviewed by EHS management, whether it's reviewed by EHS management and then goes to our Sewage, Wastewater, and Sanitation Advisory Board, which is similar to the air quality process, or to our Food Protection Hearing and Advisory Board, also similar to the air quality process. From there, it would go on to the District Board of Health. And the most recent variances were presented to the District Board of Health. There were 2 in September of 2020 and 2 in March of 2020. A waiver is very similar, except for it's only for our food facilities. It applies when an operator would like to do a food preparation process that is outside of the food code, and they can provide scientific evidence that the process won't negatively impact public health. And that process is reviewed in-house by the EHS management and food team, and then is double-checked, and once it's approved, it is double-checked upon inspection. Both are great options in advance. However, if there is a notice of violation after the permit has issued, then we move into the appeals process. What you have in front of you is one of the flows for the 5 sections on the right. Customers are notified of the appeal process in multiple ways. They are all listed in the specific regulations. They are on all inspection reports. The appeals process is listed directly between where the notice of violations are listed and where the signature line exists. And all inspection reports are provided to the consumer in writing. Recently, flow charts have been added to our website specifically for the appeals process in an effort to make them more transparent. From this flow chart, you'll see there are 2 ways that a permanent facility or operator would be issued a notice of violation. The most common is through a routine inspection that identifies a violation. The other is through a complaint. When a complaint is filed, an inspector conducts an abbreviated inspection. If the complaint is verified, then a notice of violation is issued, and it is always provided in writing. The second step for this first group is a meeting. It is an opportunity to discuss the violation, how it can be resolved, any concerns, and appropriate next steps. EHS always provides a written summary after the meeting. If the permit holder or operator would like to appeal, the next and final step is the District Board of Health. A similar process, but it involves those 2 groups, advisory boards that I mentioned earlier, are for our food and food safety and our septics and wells. The meeting in this scenario is not required. The consumer can say they don't want it, but we do highly recommend it. It's a great opportunity to provide education, really discuss the issue. The advisory boards are made up of local community members that have expertise in their specific board types, and they are willing to volunteer their time. The boards meet when there is an appeal or other board matter, and so some years they meet more often than others. Our third group, very similar process. However, due to the regulations or NAC, the appeal on these 3 groups actually goes to a state agency because those regulations are under the NAC. And finally, for our child care, environmental health services does not have individual regulations We provide the health inspection for the Human Services Agency under their regulations, so the appeal would go to them. So those are our four main categories. This is an example from our website for the flow chart that is now available. For the SB4 inspections, this appeal process flowchart is actually handed to the operator at the time of the inspection, along with information about our fines and all the contact information for the inspectors. And that is it.
Thank you, Ms. Dixon. Looking to the board for questions related to the environmental health services portion.
Hello, Chair. This is Christopher.
Yes, please.
Yes, I think similar questions. And thank you. Very well laid out. And this, I like even the proactive work we're doing to try just to communicate more. And I think that's really great. But is it the same group of people that it's been for a long time? Are there term limits? Do we put it out there? Just the same kind of questions we had for the last one. And then also when it does come to us, does it go into consent items just like the other one, or is it coming to us?
So all the ones that occurred in 2020 were under consent. They were resolved and then just came to you under consent. For the makeup of the board, I'd have to go back and look. The boards do not meet very often. They did just meet just for an education as just a reminder of Robert's Rules of Orders and those different types of things. But they don't meet as often. But I can get you all the information on their term limits and everything of that sort.
Thank you. I think those two things just kind of help bring the process out more in the open a little bit. And I say that I don't know if it's the right thing to have term limits. I'm just asking what we do and like to at least be able to know how it is and let the public know and let us make some decisions and look at that. But then also I do like the idea if anything is still in question and is coming to us, I'm going to say that I would hope that we would be very clear that that's what we are doing, that it doesn't sit in consent. But it sounds like the last things were already resolved by the time they got to us, which is fine. Those are fine to be in consent for me. Thank you.
Mr. District Health Officer.
Yes, I just wanted to comment to Councilman Dare that our astute Deputy District Attorney, Ms. Reed, pulled up the air quality regs, and we do indeed have term limits for that air pollution control hearing board of 3 years, I believe, was what she was showing me. So we'll look at the past board agendas to determine whether those terms were renewed and bring that information back to you.
Thank you. Any further comments from the board? Further comments? Do we have any public comment?
No public comment, Chair.
I'm looking for a motion for item 11. This is an action item.
I'd move to approve, and thank you for the report.
Then you got a motion. Can I get a second?
Second, Brown.
Second, Danko.
Motion and a second. All those in favor say aye.
Aye.
Aye. All opposed?
Aye.
Motion carries unanimously. Thank you, Mr. Vega, Ms. Dixon. Ms. Dixon, look forward to visiting with you to the board. I'm going to try and do a on-site visit to get a little bit more familiar. And so I appreciate you working with my calendar. Look forward to going out in the field with you. Appreciate that.
Absolutely. Happy to do it.
Item 12, presentation approval of the fiscal year 21-22 budget. Mr. District Health Officer.
Thank you, Chair Delgado. This item is for approval of our next fiscal year's budget, and there is a staff report included that Ms. Heenan put together, and I want to thank her and our fiscal compliance officers, as well as our division directors and supervisors that have worked hard in putting this budget together. There's additional information provided in an appendix that has some more detail on the budget for each of the divisions, et cetera. But I'd like to run through a PowerPoint presentation that is this available for the screen, or? Otherwise, I think everybody should have it in your packet. Are you able to pull it up? Okay.
For those that are watching, we're looking to pull up the PowerPoint. If not, Mr. Dick will go through our packets.
All right, so what I'll present to you, we'll briefly review some of the accomplishments over the past year, review the health district programs that we have, go through a summary of our revenues and expenditures, and the FY22 sources and uses of funds, which is kind of the state layout for the information that is eventually submitted to them. The impact on the fund balance over this next fiscal year and future years, and then review the next steps for the board. As far as our recent accomplishments over this current fiscal year, it's been quite an amazing response and activity related to the COVID-19 pandemic. So a huge number of press releases and media briefings, increase in our Twitter followers has been significant. We've been recognized by the Public Relations Society of America Northern Nevada Chapter for the Regional Information Center. And while we're responding to the COVID pandemic testing, tens of thousands, in fact, hundreds of thousands of people at this point for COVID-19, and doing disease investigations, and now transitioning as well to providing the vaccines. We've continued to maintain the 22 health programs, albeit with some impacts to the program delivery during the height of our redeployment of personnel. And the epidemiology and public health epidemiology program received the Nevada Public Health Association Public Health Program of the Year Award for their activities. Our community clinical health services, the Family Planning Sexual Health Program has now begun providing services at the new Our Place Family Shelter. So that's been opened. Ihcc has developed the Excellence in Food Safety Award, which was first presented at the board meeting last month. And Air Quality Management's continued to work with federal EPA on a 3-year project on wildfire smoke monitoring, one of just several that are located in the western U.S. utilizing one of our air quality monitoring stations. So if you could back up, Susie, to the 22 programs. There we go. So these are the 22 programs that we have providing services to our community that are all supported through the budget that we're presenting. So we're proposing to continue to deliver all of these program services and to get back on track to full program activity here as we're moving forward with the response to the COVID pandemic. Next slide, please. So to run through for you the different divisions and budgets and FTEs, I'll begin with Office of the District Health Officer, 9.65 FTEs in my office. We don't bring in any direct revenues, and our budget is about $2 million over the course of the year. Administrative Health Services Office, 9 FTEs, also no direct revenues, supported through indirect costs, with total expenditures about $1.5 million. Our Air Quality Management Division has 19.5 FTEs, and due to several different funding sources, being the air pollution control funds that come from the sale of $1 from each smog certificate sold in Washoe County, and the EPA, federal EPA grant funding, as well as the permit fees and fees for services, revenue of about $3.5 million, almost matching the total expenditures of about $3.5 million for our quality management. Our community and clinical health services has the largest number of FTEs at 63.68, and They receive a significant portion of revenue from federal grants, the Title X grant for family planning, direct grant that we receive. Most of the federal funding, though, coming through pass-through dollars from the state that are federal funds. And we've worked hard to increase billing for clinical services, and we generate about $500,000 of revenue from billing services. So revenues for community and clinical health services, about $4.4 million, and a budget, expenditure budget of $8.6 million. And many of these services are really safety net services for people in our community. Our environmental health services program, total FTEs of 43.65 in that division, so another large division. Total revenues coming primarily from permit fees and fees for services of over $4.5 million per year, with total expenditures exceeding that of $7.3 million over the course of the year. Our epidemiology and public health preparedness program, total FTEs of 23.26, and total revenues, which come primarily from federal grants for epidemiology and lab capacity. That's a state pass-through grant, and for public health and hospital preparedness programs also coming through, federal funds coming through the state. Vital statistics program also generates revenue within this division for charges on the birth and death certificates that are issued. Next slide, please. So the budget that we are proposing for the next fiscal year has budgeted revenues of just over $24 million, up 137,000, or about 0.6% over the FY21 adopted budget. And we are, of that budget, about $3.5 million, a little over $3.5 million on license and permit fees, and that's down about $40,000. We do have a built-in CPI increase in our fees that happen each year based on the board action when those fees were adopted, which is, I think, a good thing for keeping things current on the fees. But we do have a slight downtick in the revenue we're anticipating due to anticipated economic impacts from COVID-19 over the coming year. The grant funding, about $6.35 million, up about $120,000 over for FY22, and that's mainly due to additional funds that we're receiving for the immunization program for the COVID-19 response. The intergovernmental funds, I mentioned the funds that the Air Quality Management Program receives. Neglected to mention in the EHS revenue, also about $500,000 that come from the solid waste program based on a surcharge on each tire that's sold in Washoe County. Charges for services in the budget, $3.4 million, up about $75,000. That's due to the CPI increase that we've have for our fees, but also we've been getting some big, large permit fees resulting from surface disturbance permits for some of the solar farms that are large areas that are having the dust control permits. And then our miscellaneous budget is about level compared to FY21. And the general fund support is at about $9.5 million. That's been level funding since FY19. And that funding level actually went down from what we had received in FY18 by about $500,000. And that's because as we had adopted new fees, there was a couple of years of implementation of that fee increase, some of which was to recover the overhead charges that we had from Washoe County that they'd been subsidizing us on, and so we provided that revenue to them that we collect through the fees. If we can go to the pie chart. So our summary of the health fund revenue of that $24.16 million is shown, portrayed here in the pie chart. The largest funding support is just under 40% of the budget is that general fund transfer that we receive from the county. And then you'll see the next biggest piece being federal and state grants at 26%, licenses and permits at about 15%, the other charges for services, and then the birth and death, dust plan, pollution control, and tire revenues. Next slide, please. Our total expenditure budget for FY22 is at $25.89 million. That's up just $267,000, or about 1% over the FY21 adopted budget. So as we were going through the budget process, we were trying to be conservative with a lot of uncertainty ahead of us over the months we were developing this budget, with what the effects of the pandemic were going to be and where we were going to end up. So that was our approach to the budget. Salaries and wages making up the bulk of the budget at $13.29 million, and so that's at 168.74 FTEs, and that's up 3.47 from our FY21 budget. And some of that increase is based on some of the positions that we brought on during the year to help to support the COVID response that we have continuing forward. We tried to have most of ours COVID response personnel temporary employees, not county employees, but we did have a few people that we added. And the budget increase includes that 2.5% cost of living increase. The employee benefits are the other big chunk of the budget. The county has reduced the amount that they're intending to pay in their approach for the OPEB, for the retirement health benefits paid for employees. They had taken an approach of trying to overpay that from the minimum amount that was required, so they weren't accumulating a future liability. But with that reduction, that does drive that number down. And then, but PERS has increased, and so it'll be 0.25 or 0.5% increase, and that's split between the employee and the employer. So 0.25% increase in retirement for $61.5 or $61,000. Services and supplies, $6.182 million, and that includes the county overhead costs that have increased by about 7% for the next year. Other services and supplies increased about just over $200,000. So our increase for this year is $378,000 for services and supplies. And then capital expenditures are level at about $100,000, and that's primarily or all for support of the air quality monitoring stations and equipment. So for pie chart on the summary of our expenditures, you see clearly it's primarily salaries and wages. We have other services and supplies being the next largest piece, and the county general fund that we for the overhead charges and services provide by the support from the various county departments, including HR, tech services, the district attorney's office, et cetera. And then for as I mentioned, we were conservative. The above base request is to the county is really just a consolidation of 2 part-time positions into a one full-time position. So it's technically an above base request the way the county does the budget process, but it's just really the same FTE combined into one. So then the next slide is the sources and uses of funds. And so this basically shows you more of a spreadsheet approach of what the opening fund balances are, the total revenues that we get through those various sources, the general fund transfers. So the total revenues there and general fund transfer adding up is the total revenues. And then at the bottom, the uses of funds and expenditures totaling into the total expenditures and uses of funds. So Ms. Heenan has put this together to show you what the actual budget for 2019 and 20 was in that first column. The estimated to complete for this fiscal year for 2020, 2021, and our proposed revenue for FY 21-22. So at the end of the current, or for the next fiscal year, we expect the fund balance to be $7,793,000, so about 30% of expenditures. At the end of this year, our fund balance is about $9.5 million, and that is 24.2% of our budget. The 24.2% of our budget is it's representing that the total revenue that we've received and expenditures that we have this year is basically ginormous because of all of the funding that we have received, federal funding and through the state for the response to the COVID-19 pandemic. So ironically, we actually find ourselves in a healthy, very healthy fiscal position because we had to divert staff to respond to the COVID-19 pandemic, whose salaries then became covered by this federal response money that had been budgeted for expenditure of local funds. So the fund balance from this year is quite healthy. That is provides an opening fund balance for the budget next year, which is then has about 1.7 million of deficit spending next year to get to that ending fund balance that would be 30.1% as a percent of our expenditures. So we recognize that that's still a high fund balance, but Anna Heenan has also laid out the projections for the funding over the next 3 years following this, and the continued healthy balance but declining fund balance over that period. So this is the budget. I don't think it showed up in the slides, but we did decide also to continue within the budget of having an allocation in the budget of $500,000 that can be used for one-time expenses that we've tried to utilize to support supporting partners in the community health improvement plan objectives to achieve some of those goals. So that money will be in the budget for next fiscal year and the following fiscal years as well. And in the event that a decision is made to change the name of the district or the Washoe County Health District, that's potentially a source of funds also that could be utilized for the any printing branding requirements around that. So the if I could go through the next steps, some of you are familiar, we kind of do this budget process and we get started early because we've got a sort of a little dance ahead of us in how we interface with the county on the budget process and what's set up through the interlocal agreement. So the Board of Health, we're asking to take action on this today. But then in early March, I will meet with the city and county managers to discuss the budget with them and get their input. I will then provide that input back to the board on March 25th. And then we'll provide the budget to the county manager's office and Office of Budget. And the county manager in April will be making his recommendations to the Board of County Commissioners for the overall county FY 2022 budget, which would include the general fund transfer amount for the health district. Then on May 18th, the Board of County Commissioners will have their public hearing and possible adoption of the FY 22 budget. And on June 1st, the county then delivers their budget to the Department of Taxation. So we're recommending that you approve the budget to continue to provide the 22 programs. Total revenues budgeted at 24.2, expenditures budgeted at 25.9 million. The authorization for 168.74 FTEs with that anticipated 7,793,000 fund balance. As is noted on this slide, the approval today doesn't prevent us to make adjustments that may be necessary as we continue moving forward with the county on the adoption of the budget by the Board of County Commissioners. And if there are any significant changes in that process, we'll come back to the board to inform you of that. So that concludes my presentation. I'd be happy to take any questions or
Thank you, District Health Officer. Looking to the board for questions in relation to the recommended budget.
Chairman.
Yes, Vice Chair.
If I may. Mr. Health District Officer, I want to go back a couple slides to the expenditures in regards to the salary and wages portion of this. It includes employee merit increases. Were those merit increases across the board for all 168.74 FTEs, or?
Yes, thank you for that.
Was that based on the county?
Yeah, thank you for that question. It's based, our employees are county employees.
Right.
And so they fall under the, both the county code for the employees as well as the negotiated labor agreements that the county has. And so that's the 5% annual merit that is provided to anybody who's meeting expectations in their performance.
Thank you for the clarification. I do appreciate that. One other thing I do have, and this maybe is for you or Mr. and Ms. Hainan. Obviously the funding that we received directly to the health district from CARES funding for the pandemic response obviously is not accounted for. Obviously in an ongoing budget, we anticipate getting money that's going to impact next year's budget. Is that going to be separately accounted for outside of the budget, or what's the anticipation? So for transparency, obviously you can't budget for it now because we don't have it and don't know it. But how do you plan to account for that?
Yeah, so thanks again for that question. We do anticipate receiving significant additional federal grant dollars, both from, we know from funds that were in the December stimulus bill in Washington, D.C., that we are already working on a grant application to the state, applying for about $15.2 million. And then there's another one that I believe is going to be about $3.8 million that are both out of that December stimulus. And what we'll do with those, once we have a funding agreement for those will come before the District Board of Health for approval by the board, and then those will go to the Board of County Commissioners as well for approval and for adjustment. Both of those would be for adjustments of the budget so that they all show up in that budget, similar to the way that additional funding showed up when I showed you the sources and uses spreadsheet.
Thank you, Chairman.
Great questions. Any further comments from the board?
Chair, this is Christopher Dare.
Yes.
I just wanted to say thank you. I know that's a lot of information, a lot to digest. My questions were answered by what Commissioner Lucy asked, but I'm looking forward to see what might come, how that affects things, and where we'll be sitting together. But thanks for the layout and thanks for the PowerPoint. That helps digest information a little easier. Thanks.
Thank you. Any further comments? Any public comment?
No public comment.
Can I get a motion, please?
Chairman, I make the motion to accept the budget presentation as presented in the packet.
So moved.
Motion and a second. All those in favor, aye.
Aye.
All opposed? Motion carries unanimously. Thank you, Mr. District Health Officer. Moving on to item 13 regarding the legislative issues. Ms. Gutman-Dotson.
Good afternoon, board. Thanks for having me. I'll make it quick. I know this meeting has gone long, so I just wanted to give a brief update. Session is in full swing. Still not registered as a lobbyist yet, but that bill has gone through one house and it's on its way to another. So they're figuring out how to sign up virtual lobbyists. So I just wanted to talk about 3 bills very briefly that we've been active on so far. SB 36 was a bill sponsored by the Department of Education that included the District Board of Health in their planning for a committee that will develop in a response to emergencies dealing with suicides. So they included a member from the District Board of Health. The Southern Nevada Health District asked that language also include possibly a designee from a District Board of Health. So Dania helped us with that language, and that has been an adopted amendment. So whether it's a member of our District Board of Health or a member of our staff from emergency services, that will be implemented probably in the next year. SB 2 was a bill brought forth by Clark County School District. They were trying to, it was a huge bill, but trying to eliminate a lot of their unfunded mandates. One of them being the collection of BMI in 4th, 7th, and 10th grade students in our school districts, Washoe and Clark County. We worked with them to overcome some of the hurdles. We agreed to drop 1 grade and go to an every other year data collection. That's what the school districts were comfortable with the agreement that the district boards of health will be helpful with the collection and the dissemination of the data. So that was SB 2. And then AB 59 is the Attorney General's T21 Tobacco 21 bill. That was heard last week in Assembly Judiciary, and we are working with the Attorney General's office amongst a lot of advocacy groups, cancer coalitions, the Tobacco Coalition, the health districts, and some public health advocates to make that bill a little bit better, a little bit more enforceable. So we're back and forth with the AG's office, working together with them. It was on work session for tomorrow to be passed out of the committee, but that has been pulled, so we have a little more time to work on it. A couple other things. We got some good press from the Nevada Independent yesterday. They brought to the attention of the public that SB 263 funding from last session was cut for the public health districts. So that was great that that's been highlighted. And still keeping an eye on things. There's still, a lot of bills that are BDRs that's language hasn't been dropped yet. We are waiting for the classic vehicle loophole bill to be dropped. That's coming shortly from Assemblyman Howard Watts. And I'm just keeping a close eye on all things public health related. There's a couple of hemp bills that we're keeping a close eye on, marijuana bills, behavioral health, and housing bills. So that's my update. Any questions?
Thank you for the presentation. Thank you for the presentation. Any questions from the board? See no comments from the board. Any public comments?
No public comment.
No public comments. Thank you for that summarized, quick layout. Appreciate it so much.
Thank you.
This is an action item, so can I get a Can I get a,
Move to approve, Christopher Dare.
Second.
Second, Rika Danko.
all those in favor?
Aye.
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 All opposed?
Aye.
Motion carries. Thank you.
Thank you.
Stay safe, Ms. Governor. Mr. Dodson. Item 14, staff reports. Air quality management, Mr. Vega.
Yes, thank you, Mr. Chair, members of the board. For the record, Francisco Vega, Director of the Washoe County Air Quality Management Division. I don't have much to add. I did want to touch on one of the things I mentioned in the program update, which was the new report which quantifies the benefits of driving on electricity in Nevada. Again, Washoe County continues to find itself at the limit for ozone, and that's against the EPA's National Ambient Air Quality Standards. So we're looking for opportunities to reduce those emissions that contribute to ozone, and obviously electric vehicles is one of those things. So just wanted to mention that, and I'd be happy to answer any kind of questions.
Thank you, Mr. Vega. Any questions for Mr. Vega, air quality management? Seeing none, thank you, sir, for your report. Item B, Community Clinical Health Services, Ms. Loretz.
Hi, Lisa Lottritz, Division Director for Community and Clinical Health Services. And I just wanted to add to my report that our sexual health program has gotten the green light to go back into the Washoe County Sheriff's Office to provide testing. We're still working on getting back in there for family planning services. It probably will be at least another month for that. But our family planning program is still providing services at the Our Place shelter. So we are doing that twice a month. And that's all I have to add, but I'm happy to answer any questions you might have.
Any questions from the board? Thank you very much, Ms. Loretz. Item C, Environmental Health Services, Ms. Dixon.
Good afternoon. For the record, again, Erin Dixon, Division Director, Environmental Health Services. Just wanted to highlight two small items. Our food safety program is excited to get back on track with the training and recertification of staff. It's required every 3 years, and last year was a little bit of a struggle to get staff trained, so we're back on track, and we'll have all staff again standardized by the end of the year. And just wanted to point out that our land development has seen a significant increase in both septic and wells. January from this year to last year was an increase of 33% and 24% respectively. So we expect that increase to continue. That is all I have to add, and I'm happy to answer any questions.
Any questions for Ms. Dixon? Seeing none, thank you very much for the report. Item D, epidemiology. We have Dr. Dow.
Hi, good afternoon, everyone, Mr. Chairman and members of the board. I'm Nancy Dow, new Division Director of Epidemiology and Public Health Preparedness. I'm humbled to be here for my first month, and much thanks to staff who helped put together this report. So our epidemiology team is working on, and we'll have a presentation ready on our influenza trend and surveillance this season in the March board meeting. For this report, I do not have anything in particular to add. I'm happy to answer any questions you may have. Thank you.
Welcome. Great to see you. Any questions from the board? Thank you very much. We'll close item D. Thank you for the report. Item E, Mr. District Health Officer.
Thank you, Chair Delgado. Just wanted to provide a few updates on the COVID-19 response. I'm happy to report that this week is the first week in a very long time that Washoe County is no longer flagged under the state's county tracking system for elevated disease transmission. So as of the 22nd of February, we were only flagged for the number of new cases per 100,000 population over a 30-day period. Our test positivity rate had declined below the 8% threshold positivity that the state was using, so we were at 7.3%, but that decline actually is, we're currently at 6.4% positivity as of today, and our new cases per 100,000 have gone down from 559 that we had last week that I'd reported are now at 409. So that trend has continued to be in the right direction for us. We have been very busy both here at the health district and across the community with administering the COVID-19 vaccines. And so as of yesterday, when the state updated the Washoe County numbers, we're at over 107,000 total doses administered in Washoe County. And that's approximately 15% of our population that have received just the first dose so far, and about 8% of our population that's received both doses to date. And of those doses administered, the Washoe County Health District administered 44,172 doses. We're now wrapping up the frontline community support group with continuity of government, essential public transportation staff, and mortuary services. And we're beginning to work on opening up for the frontline supply chain and logistics group, and are getting some invitations sent out for food processing facilities. We have sent invitations to all of the 70 and older individuals that are on our wait list, and we're now going to be moving to 65 and older, and our pharmacies and community partners, including Renown Health and Community Health Alliance, are also moving to the 65 and older. We're working with the Sheriff's Office and are vaccinating inmates who are 65 and older. We're continuing to provide homebound vaccinations 3 days a week, where we have one of our nurses going out with a Remsa paramedic and providing 6 first doses to individuals and 6 second doses to other individuals each day. There was a clinic that was held at Access to Healthcare Network on Friday last week. 211 vaccines were administered. 23% of those individuals that were vaccinated were Hispanic. And Community Health Alliance also conducted a pod last Saturday. And we've been working hard to try to ensure that people from our high-need zip codes areas are invited to be vaccinated. We work to provide Community Health Alliance with people that were in the 89502 zip code area where their clinic is located. And we also worked hard to call over 2,000 individuals that we had phone numbers for, but not internet access, to get them scheduled for vaccinations through our pod. We did just receive demographic information from the state on the people vaccinated in Washoe County, and that does not reflect that the vaccinations are being dispensed in proportion to the different populations by ethnic and racial groups. So for our Hispanic population, that data is showing 9.1% of the doses we've administered have been received by the Hispanic population. 1.1% have been received by the African American population. 10.6% have been administered to people that identified as multiracial, and 63.8% were administered to people that identified as white. We had 8% that did not provide information on race and ethnicity. So I think it's important to understand, though, that the numbers that we're reporting now are also quite heavily influenced by that phase one of the implementation, in which we were focusing on getting the essential workforce vaccinated, beginning with our hospital and emergency room frontline staff, moving on to other healthcare providers, first responders, EMS, public health, et cetera. So I think with well, it's certainly a challenge, and we'll be working hard to try to ensure that we're getting our minority populations vaccinated. We're also going to be seeing the influence of that initial activity because we know that occupationally we don't see those same demographics appearing in each occupational group. And I think as we work further down through the essential services, we're going to begin to also see more of that general population representation through the essential services as well. But we'll continue to try to obtain this information from the state and make it available to our community as we move forward. I also wanted to mention the state has a scheduling software that they have been working to provide called it's a Salesforce platform that MTX is the consultant that they're working on. We have delayed our go live for that so that the platform can have the additional functionality built that we need for it, and we're shooting to use that to begin using that for our pod scheduling for the pod that we'll have on March 16th. And then we're really, in our operations, limited by the available vaccine that we can receive from the federal government and through the state. And so we're hearing that there's going to be additional vaccine, and we sincerely hope that we will begin receiving some significantly increased amounts of vaccine soon. And then today, I received a letter from several individuals, looks like a husband and wife that came through our pod, and so I just wanted to share that. They actually wrote this letter and sent it through the mail to us. So it says, last Thursday, February 18th, my wife and I received our first shot of the coronavirus vaccine at the Livestock Events Center. We were not exactly sure what to expect other than in a general way, but were pleasantly surprised to find it in every way a positive experience. From the time we received our email notification until we completed the actual vaccine shots, everything went more smoothly than we expected. I definitely want to recognize all the people involved in the process, especially those we came in contact with on a personal basis. The day of our shot, the weather was unpleasant, but everyone from the folks guiding us into the proper lane to those guiding us out of the parking area behaved in a personable, professional manner. They were very careful to explain everything and answer whatever questions we had. Even though we had to wait longer after the inoculation due to a one-time epinephrine episode my wife had years ago, they were careful to explain how they would rather err on the side of extreme caution. I served in the military for over 20 years, so waiting in lines is nothing new for me, but we both felt that everyone was making a big effort to make it as painless as possible, and we want them to realize how all that effort affects those of us on the receiving end. So a big thank you to everyone from us, James and Judith. So I thought that was great that they took the time to provide us with that thank you and that feedback. And then just the other thing I would mention is we've completed the annual maintenance for our accreditation with our submissions to the Public Health Accreditation Board. So I wanted to thank all the staff that were involved in getting that accomplished.
Thank you for that report, District Health Officer. Comments from the board with respect to the report?
Chairman?
Yes, Vice Chair.
I did want to point out that I've also received from a number of individuals how effective and functional the pod has been at the Livestock Event Center in regards to the vaccine. A number of people have taken the time to pull me aside and acknowledge how efficient and smooth it was for them to receive the vaccine, and they were very thankful for that. So, Mr. Health District Officer, congratulations and well done on organizing that with your staff. I think it's been well received, and how that rollout has been very smooth and not they're not clunky. So, congratulations to you in regards to that.
Thank you.
And for those comments, any further comments?
Yes, Chair, this is Christopher. I just want to echo that, and I keep hearing the same, and we even have other jurisdictions that are asking these guys how they're doing it, and that's just a testament to our staff, to the leadership of our health officer, and I'd even say it's to our community because we have a lot of volunteers out there. And so I would just say at large, man, it's good to be part of a community that knows how to work together. And I think that's the key to the future of what we're about to try to do is pull this thing back together and keep running after stuff. But good job, and good job to the staff as well.
Chairman?
Yes,
I do actually have a question that I forgot that I asked. Mr. Health District Officer, I contacted last week by Walmart. Obviously, we all know that Walmart is receiving their allocation for the vaccine federally. As you pointed out, some of the questions that have been the disparities and if with vaccine, basically the vaccine equality. With the rollout of the Walmart vaccine allocation, hopefully those locations are they working in conjunction with you to identify those areas in which they can better service and provide that vaccine to these individuals throughout the community, throughout the region, and so that we're not redundant in our efforts? Is that going to be something that we could utilize to be helpful? And have you been in conversations with them in regards to that?
Yeah, thank you for asking that question. It's the coordination is not what I would like to see at this time with the pharmacies. The way the vaccine is allocated to them is through the federal pharmacy program. And so they're receiving the vaccine directly under an agreement that they have with the federal government. And it's I've asked the state if they can provide us with more information regarding how much is being allocated to those pharmacies in Washoe County and which pharmacies are receiving it. And so I don't know if you have an opportunity to help with some of that communication and getting us connected, that could be helpful. I do know that we had some communication about different community locations, though, with Walmart that they might utilize. And they, I think, ended up working with the city of Reno and have a clinic that they're planning for their Ihcc location. But right now, our connection across the pharmacies and the coordination is not really good. But I did hear from the city of Reno, and then I think I heard it in the news as well, that the plans for the Ihcc location with the Walmart.
Okay, and I know on our Wednesday morning phone calls, the numbers have been challenging at best with the state, and I know they're working as fast as they can to rectify a lot of those issues. But do we know, will Walmart have to, because obviously, there are legislators and individuals that are asking about that, vaccine disparity. Will those numbers be clarified via Walmart through the state, or are they going to offer those directly to you? Do you know? And maybe that's, and Mr. DA, if I'm getting too far off topic, but you can pull me over. I'm happy to do that at a later time date.
Yeah, at this point, the only demographic numbers that we have from the state are for all of the vaccine that they have records for that's dispensed in Washoe County. Okay. And so we don't have any breakdown on the data as to like what Walmart's demographics look like versus health districts or Community Health Alliance or Renown or anybody else.
Okay, thank you. Thank you, Mr. Chair. I appreciate
Good questions. No, great questions. Any further questions from the board? Seeing none, thank you, District Health Officer. Appreciate it. And to the team, tremendous work, and appreciate also their ability to be so nimble and creative constantly with the changing of tides, especially with how many vaccines come in and having to adapt to that. And I appreciate everyone's efforts on trying to raise the equity issue in our community to get more vaccines into those communities that are disproportionately been impacted by COVID. So thank you for constantly working on that. Ending with closing out item 14, item 15, board comments. Any comments from the board?
Chairman, I do want to say a couple quick comments.
Vice Chair, go ahead.
Thank you, Chairman. First of all, I want to apologize about my attendance last meeting. Unfortunately, via phone during the snowstorm was not the best way to do that. And we did receive, at my house where I was working from, we received about 50 inches of snow. So I had quite a bit to deal with that day. So I apologize about my attendance. I want to put that out there for all the board. I do want to thank everybody for their confidence in my ability to help serve in leadership on this board, and I do really enjoy the opportunity. I would like to ask, Mr. Dick, if we can bring back on a future agenda I know during the concurrent meeting, the entities had asked for a response in regards to, and I know we're working on some of those. Can we get an update from you in regards to your opinion and your response to the entities based upon the concerns that were voiced by the entities? Also, can I get a presentation in regards to the the COVID costs and funds that we've received in the first CARES funding, and then maybe potentially what you, with the potential funding that we may see in the next, hopefully next couple months or so, what those funds would be intended to use for going forward. So if I could see that would be great. Those are the only two items I have, Chairman. Thank you.
Thank you. Further comments from the board?
I do have one. Thank you, Chair. I'd like us to talk about or have a presentation on what our role is in the upcoming potential of events as they unfold in the summer and the fall. I know where we're at COVID-wise, but I have concerns to make sure we're proactive, or we'll find that this particular season just disappears as well. But I just want to know our role and how that fits, if we can.
Great. I had the same thoughts, Councilman, and so I know the district health officer is working on that as we speak with the other jurisdictions. Any other comments from the board?
Chairman, actually, one other thing.
Yes, Vice Chair.
Mr. Dick, another thing, obviously with the dates that the governor has put forth on his relaxing of the requirements for the pause, we have a May 1st date about returning the authority to local authority. I know that you've been in conversations with the municipalities and the county in regards to that. Can we potentially have a discussion? I know that's going to be a larger discussion, obviously, or a presentation to the board about, and hopefully by March or April, about what that plan may look like, and your recommendations with that as well, just so that we have a clear understanding for that full transparency.
Yes, we will do that. I've been in conversations with the district health officer with exactly that. And here's an option or a thought that I had in talking with our district health officer is the potential for maybe a special meeting with relation to when we get into some of those deadlines and dates, if we're not, or maybe a direct memo from the district health officer as it relates to what those benchmarks are, or just the direct communication as they go out to the city. I know that's something, or to the county, of course, with just different opening dates and things to start to change. So we'll keep everyone appraised as to what that may look like.
Thank you, Chairman.
Further comments?
I just have one, and I'd say this as we go forward, if we do need to meet more, obviously we're at the center of this particular conversation, especially as it opens up. I just wanted to say that I'm sure we're all willing, but I know I am, and I just it's crucial that we get to be a part of helping to assure this folds out as a region the best we can. Thanks.
Thank you. Seeing no other board comments, I'll close item 15. Any public comment?
No public comment, Chair.
Closing item 16. Can I get an adjournment, please?
Move to adjourn.
Got a first. Can I get a second?
Second.
Second, Rika Danko.
All in favor, aye?
Aye.
All opposed?
Aye.
Thank you, everybody. You guys stay safe. Thank you. Sorry for the long meeting.